dental college, at least I know that our lecture starts at 8 o'clock. So I don't know how many of the students really take care in brushing their teeth and all that. So probably it is there in most of the other professional colleges also. So that's where we don't brush the teeth properly. So I put a small quote there. Don't rush when you brush. Take your time, be slow, and give enough thought while you're brushing. So, suppose if you rush while you're brushing, what happens? There can be food impaction or food lodgement between the teeth. Naturally, in our teeth, there are certain gaps which come naturally by birth or because of the tooth structure and all that, or sometimes because of any health issues, dental health issues also, there can be gaps between the teeth. So they can be food impacted. Many of us would have noticed. And those people who have already crossed their 45 and 50s, it is 100% I can say that they will be having food impaction issues with them. So for that, of course, why it is there, how it can be avoided, all that has to be dealt in a different chapter again. And then comes your drying out, brush properly. Some of the teeth are not there. Sometimes the teeth get dried up and the whole oral cavity. Especially when you're having a temperature and fever and all that, when you're sick. What happens? The whole mouth becomes dry. We don't take enough water, so that's when the mouth becomes dry. So whenever the mouth becomes dry, immediately the bacteria in the oral cavity or in the mouth, they tend to multiply. And once they multiply, that is when there are chances of having a tooth decay. So food lodgement is one of the reasons for the tooth decay. Because of excess of food impaction, bacteria increases and then there's a tooth decay. Simultaneously, dry mouth, as I told you, people who take less amount of water or the elderly age group people, the saliva is not there properly, or also people who have a low calcium in their teeth. When you notice certain people, the teeth are not really white in color. They are like hazy white in color, or you can make out a typical demarcation. That's the reason I put a picture there. You can see the demarcation where the upper tooth and the other half of the tooth, they're two different colors. That is a typical indication of low calcium teeth. So the people who have low calcium also, they're more prone for tooth decay. And comes your sticky food. Yes. As a dentist, I can tell you that sugar is one major culprit for a tooth decay. At the same time, I don't say we should avoid eating sugars or sweets, or we should totally stop or give up eating sugars and sweets. That's not so. I'm a sweet lover. But I don't have a single decay tooth. In my family, most of them have sweets. We take a good amount of sweets, but I didn't see anybody having a tooth decay. Excuse me. It's because the way the sweets are taken is important. So usually the sugars or sweets which are sticky in consistency, it usually beats because they eat sticky foods because of the bakeries and the fast food that's available so much in the market now, and the varieties are so tempting, especially the television advertisements that are given about the ice creams or the carbonated drinks or the chocolates or dairy milk. I only knew about the 5-star chocolate when I was young. And we also used to have the peppermints when we were young. And peppermints were not very sweet like how they are today. I remember buying it for one paise. One paise we used to get, almost 10 small little toffees, which were not sticky. Then the evolution started, and then the 5-star has come into picture. This particular 5-star is the culprit because it is very sticky. I don't know how many of you have taken 5-star these days. But after 5-star, then there comes the dairy milk and then dairy silk. These are all, very, very sticky foods. They get into the tooth structure, and that's when they get inside, and the bacteria starts developing, and that is the reason we have a tooth decay. That is the reason we tell do not take any sugars and sticky foods. Otherwise, like you can have a payasam at home, you can have a carrot halwa at home, that is fine. You can have a laddu at home because they're not sticky. So you have a demarcation there. Sugars. So please do not think sugar eating can cause dental caries. It is definitely there. Then comes your tartar. Tartar is the plaque or the debris that we see on tooth structure. You can see on that, the yellowish plaque that is there on the tooth structure, on the gums and all that. That is what is the bacterial colonies actually on the tooth structure. Just go to the mirror, see. You can even observe in your parents' oral mouth also, or grandparents' mouth also. If anybody having that kind of plaque on the tooth structure, yellowish plaque on the tooth structure, make sure that is being removed or cleaned thoroughly by a professional. That is your dentist who stays nearby. You can go and get it done. Of course, I agree. It's a COVID time now, so people don't want to take any risk of going to a dentist now. But that's okay. If the dentist is taking enough precautions and then care, wearing a PPE and then all that, I think it's fine. But it's not an issue. You can as well go and get it treated. So these are the few common reasons, why a person can have a tooth decay. So today's say, which you have to remember is, do not rush when you brush your teeth. So please remember, it's a mantra. Don't rush when you brush. Now, do you have any of these symptoms, or any of your family members have the symptoms? And if yes, it's time to visit your dentist. Like, you can have a pain in the oral cavity, any of your tooth, and you don't know which tooth actually is paining sometimes. But you have a pain on one side. You have a pain in the ear sometimes. You have a pain while sleeping on the pillow. So you can see the picture there. She's sleeping on the pillow, on the head raised position. That is when, you can have pain. Sometimes people have pain while eating an ice cream. Sometimes people have a sensitivity or pain while having a hot cup of tea or coffee. Sometimes people have fever also, and they don't know for what they have fever, but they have some mild pain somewhere in the mouth where they do not know, but yet they have fever. And sometimes they have swelling in this region. They can feel it. People can feel it. We call it as a lymph node in our language. And then they don't know where they have pain, but they definitely have a small swelling in this region. And that's what we call as a submandibular gland. And sometimes you can see a swelling outside also, like a small lump outside, as you see in the picture. So anybody having any of the symptoms, please, it's an alert that you must go and visit your dentist nearby.
So, ma'am, we have a doubt, ma'am.
Yes.
Here we have a question from Srujana.
Yes.
She says, Madam, shall we avoid tooth decay at earlier stage by undergoing tooth cleaning process?
Yeah. Now, it's Srujana, right? Is it Srujana? Hello, Srujana, you can definitely avoid tooth decay by definitely consulting a dentist first, and cleaning is required. Cleaning will be done only if there is a need. See, not necessarily everybody has to go for a cleaning. When the dentist checks, and if there is a plaque, yellow plaque on your teeth, or if there is a blackish color on your tooth, or if you have an food lodgement in your teeth, between the teeth, that is when, or if you have a sensitivity, yes, definitely you must go and visit. Even otherwise, in case you do not have any of these symptoms also, please, if it is for the first time, I definitely would advise you to go and visit a dentist, because first time probably you can find out something new, something which you may not be knowing. Definitely I would advise you to go for a visit. And once you visit, and let it be once in 2 years or 3 years, or once in a year or 6 months once, whenever you have any complaint, you can definitely go. Yes. Yes? Am I clear?
Yes, ma'am.
Can I go ahead?
Yes, ma'am.
Yeah. Now that we have seen about the the importance of traveling. They avoid eating ice creams. Children are not eating food because they feel, I don't know, తినట్లేదు ఆకలి వేస్తుందంటే తినట్లేదు బాబు ఏడుస్తున్నాడు కానీ పాలు తాగట్లేదు బాబు ఏడుస్తున్నాడు కానీ అన్నం తినట్లేదు. This is how they say. But they miss the point that Maybe the child is not able to chew the food because it's a decayed tooth inside. They hardly see the teeth. Parents hardly see the teeth and brush the teeth. So, they don't, it goes unnoticed, and that is the reason the child keeps losing his weight also. And he becomes very irritable because of not able to eat the food. So, for all the parents, young parents and all, kindly notice where the problem is. If they're not able to eat the food properly, or chew the food properly. Yeah. Then comes the stages of tooth impaction because of sticky food or because of the dry mouth and the various symptoms that we have seen how it can happen. Now I'll go a little into the detail. When actually you must actually see the dentist. In our language, you call it as a teeth decay in the enamel, advanced decay, decay in the dentine, decay in the pulp. So this is how we have 4 stages. We tend to identify, and each of these 4 stages, they have a symptom. Like, in the first stage, decay in the enamel, we can see there is some kind of a food lodgement. You eat food, either it's stuck in between the teeth or on the tooth surface only. And when you watch you yourself can see in the mirror, you can see that, that it's become a little dark or brownish color. That is the first sign that you must visit a dentist. By any chance, you miss the stage and goes to the next stage, which is called little advanced decay, and it goes to the next stage. That is when, patients, they complain of sensitivity. Sensitivity with, we have seen in the previous slide of cold and hot, these are the symptoms. Sometimes people also, it's a very rare thing, but that is also one of the signs and symptoms that we see. And sensitivity is one thing. Then comes your decay in dentine. If the next layer or the process decay starts a little deeper, goes little deeper into the tooth structure, we call it as, patients generally have severe sensitivity. Sensitivity to an extent that, they avoid eating any kind of a food. They totally avoid having hot and cold. That is the point. It's a point. They must visit a dentist. In spite of having that, they try to take some tablets or use some toothpaste that, in the televisions, people actually watch, these Sensodyne, Sensoform and all. There are patients who come and tell us that we have been using Sensoform since 10 years. So that means the television, the media is playing such a big role that, that means a dentist is not required for them. So every tooth has a reason, and what kind of a tooth desensitizing paste that is called as to be used has to be decided by the dentist. It's not that it's coming in the television and then you buy it across the counter and then start using. So there can be a reason whether it is for hot or whether it is cold. So which kind of paste has to be used, that will be decided by the doctor. Anyway, the next stage is the decay in the pulp. So that is when the patient can have a severe pain, and it's unbearable. They cannot sit, they cannot sleep. That kind of a pain. Any kind of a position, they have severe pain. And especially on the sleeping posture, they'll have much more pain. And before I stop, go to the next slide, I just want to show you that you can see there are 3 layers. The topmost layer, which is in white color, we call it as enamel. That's a tooth structure actually. I forgot to include that structure in my previous slides. The second slide, which is yellowish brown, light yellowish brown, we call it as a second layer of the tooth, that is the dentine. That's why in the third point, we have said as decay in the dentine. And the fourth is the pulp. That is where the blood supply and the nerve supply of every tooth lies. And the most important part of the tooth, that's we call as the heart of the tooth, actually. The heart of the tooth. It's so very important. And once that heart or the pulp is affected, that is when the patient has severe pain. And the treatment goes on. Like if it is in the initial phases of decay in the enamel or advanced decay, we do restorations. And restorations also, we have plenty of materials, and depending on the tooth structure, depending on the patient's complaint, and accordingly we take x-rays and then we try to do or place a particular type of restorative material. And now as the sensitivity increases, the pain increases, then the tooth goes for root canal treatment. And I'm sure many of you would have heard of all this root canal treatment and all that. Some people say it's very, very painful. Root canal treatment, oh, it's so very painful, so many sittings and all. Some say, oh, nothing, they just give some anesthesia and then do the treatment. So it depends on the pain perception of the person. That's the most important thing. So the treatment procedure is almost the same. Anybody, any doctor does. But the pain perception of the individual is important. And that is when they say that I had no pain or I had severe pain. So this demarcation happens. So that's about the tooth decay, the causes, the reasons, and what to do, what not to do. Right. Let's go to the next slide. So please remember, if it's a healthy tooth, just go to now. The Srijana had asked us in the beginning, if I go to a doctor now, can I avoid tooth decay? Yes, you can avoid tooth decay as well as you can save your pocket also. So please remember, your healthy tooth saves money. You can only go for a consultation, pay some money, and keep your teeth safe. But as the progress of the tooth decay increases and the problem increases, the neglect you do, it's an infection, and then it's a dead tooth. So as the tooth becomes dead, so is your cost. So the severe the problem, more the cost. Because if it is a dead tooth, yeah. Now somebody can ask me a question here. Now anyway, the tooth is dead, so it's okay. I have got my tooth removed. So how does it matter? Because I have a rest of the teeth in my mouth. And you may tell me, it seems, we have 28 teeth or 32 set of teeth. So if one tooth is lost, how does it matter? Yeah, if one tooth is lost, it's not a problem. But to replace the tooth, you have to shell down some amount of money. And that is what is of concern. And that's very expensive. So people who have already visited and probably would have gone for a replacement, they will tell you. Now you can talk to them and see if this slide of mine is correct or wrong. Now, what are the 5 golden rules that you need to remember? The first thing is eat a healthy food, that is more amount of healthy food, like fibrous food is what is important. Then avoid any sticky food and avoid eating sticky food between the meals. See, in our olden days, the tradition of having a food was it's only 3 times a day. Some people used to eat only twice a day. Morning, around 10 or 11 o'clock, they used to have their meals, and again in the night dinner they used to have. In between, they do not have any meal. But then slowly the tradition, evolution, time zone, lifestyle, everything has changed. Profession, people have, everything has changed, and people are eating whatever is available, in the closer to them. People are software engineers. They work in offices where food is supplied to them, and very frequently, the coffee makers are placed in their offices, and very frequently they have tea with sugar and coffee with sugar and so on. So all these things, piled up for a very long time, can affect your teeth. So avoid sticky food, avoid food having between the meals, and preferably fibrous food is easy, because if it is fibrous food, it actually makes self. I'm sorry, just for a minute.
Ma'am, so can I take the questions now, ma'am?
Yeah, please.
That's very good. Okay. From Malika, hello, ma'am. How are your views regarding oil pulling method?
Okay. Oil pulling is one of the traditional methods, I can say. It's actually an ancient practice, though it has come into limelight, or in the recent years, people are talking about it. But it is definitely an ancient practice. How does it help? It helps. That is a question mark, because I haven't really seen anybody and really not having any dental problems, especially the tooth decay. Maybe there is the research was done, and they say that because of the oil pulling, a thin layer of oil, actually a slimy layer of oil, forms on the tooth structure, on the teeth and on the gums. And because of that, maybe the bacteria which are there in the oral cavity or in the mouth, they do not get stuck onto the tooth structure or on the gums. And that is how it can help. But Malika, in case we do oil pulling and we do not brush our teeth, the bacteria bacteria doesn't go anywhere. And the next morning, when you see, you can still feel the slimy layer. And on that layer, some amount of bacterial multiplication may be there. So the feeling of the teeth or the mouth being fresh is not there. That is the first drawback with oil pulling. How it is beneficial? Yeah, maybe it is a temporary phase. I don't say on a regular basis. If only oil pulling is done without brushing the teeth, I do not really advise my patients. But oil pulling can just help or add to the regular practices of your cleaning. Maybe once a day in the night time you can just do that and sleep. But that is not the only way to stop the dental problems.
Yes, ma'am. We have other few questions. From Pravina Palla, is brushing teeth with baking soda or salt suggestible? Does it help in removing plaque?
Yeah. Yeah, again, these are the practices generally done in the at home remedies, we say. Actually, I have a slide actually picture with home remedies, we say. People do use them, like, baking soda, salt, especially rock salt, some people use, or, to some extent it removes, but total control definitely doesn't happen. And in fact, we found out that in few of our among patients or studies done in our institutions and all, if the salt or the powders are little rough in its texture, they tend to remove some amount of enamel also. If it's not done on long run, see, anything which is done for a longer duration is harmful. Please remember. For a short while, maybe temporarily or once in a while, or you are traveling somewhere and you did not take your paste and brush, and then that's how you want to, but you want your teeth to be clean. Yes, for that sake it is fine, but not on a regular basis. Regular basis, we do not advise using salt or the baking powder directly. These days in the paste also they say salt added or charcoal added. This paste we are getting, we don't know how much amount is added into that, but the fineness of the paste remains the same, and that is what is important. Because the present generation, the enamel, the teeth are not very strong as it used to be in the older generations. So that's the reason, the evolution from the tooth powder, charcoal, brick powder and all this to use in the ancient times, from there slowly it has come down to Colgate tooth powders. You would have seen certain boxes, Colgate tooth powders, and now they're extinct. They're no more available in the market. Very, very few people. The Dantamanjan and all, which are very rarely used by people these days. Herbal powders are coming, yet they have to be very, very fine if they have to be used. That's the reason we avoid saying baking powder or salt to avoid, on a long run. Next slide. Next, yes.
Next question, ma'am.
Yeah.
Johnny, hello, ma'am. Removal of teeth can removal of teeth affect our eyes?
Yeah, Johnny, I think I'll be coming to that facts and myths in the little next few slides. I hope you'll be with me to see those slides. Very interesting facts I'm going to talk about. Is it fine if I go back? For the next slides, that answer is there?
Yes, ma'am, no problem.
Yeah.
And we have one more question, ma'am. We'll complete with that.
Yeah.
Rupavati. Yeah. Ma'am, generally, what kind of paste is used by every person as daily, but not any kind of problem of tooth?
Right. Johnny, right?
Rupavati, ma'am.
Rupavati. Yeah. Rupavati, please hold on if you don't mind, because I'm coming to that point now. Next. So I'll be able to explain there better. I hope you'll be with me for some time. Is that okay? Is it okay, Nihalika?
Yeah, yes, ma'am, it is.
Yeah, because that will be more interesting because I have some more facts there to say.
Yes, ma'am.
Right? Yeah. For now, the 5 golden rules, as we say, avoid having sticky foods in between meals, have more amount of fibrous food, and don't eat between the meals, and have a lot of calcium, vitamin C, etc. The fruits and all, brushing twice daily, and definitely use a tongue cleaner. Don't forget, the toothbrush and the tongue cleaner, they go hand in hand. Like, they are together. They have to travel together like husband and wife. So make sure your toothbrush and the tongue cleaner they go together whenever the the teeth maintenance, is talked about. Yeah. So until now we have seen about the tooth decay. Now let's see about the gum diseases. So when you see, probably you can see again, examine your own gums in the mirror. Sometimes there is something like red gums, swollen gums. Sometimes there can be bleeding gums. Okay, when we brush the teeth, immediately we see a blood spot in the oral cavity, or when we are spitting in the in the wash basin, we see some red color coming out along with our saliva in the with the saliva also, with the red color comes out. Bleeding can be there. Sometimes there can be a bad breath, and there is an advertisement, in the before we go to any movie, the trailer is, we see that the boy is running away. The girl is actually running away from the boy. She tries to hold like this because he comes, and then he uses a toothbrush. I think it's a Pepsodent ad or something. I'm not sure about the ad. Pepsodent probably, or some fresh, some I don't know, some
mouth freshener, ma'am. It's a mouth freshener.
Yeah. So once he uses, and then he comes closer to her, and then she accepts him, right? So bad breath is one of the signs, where the gum diseases are in the beginning. And you can see in the center, you have slight, moderate, and heavy, severe and heavy, right? Moderate, heavy, and severe. So you can see the yellow color there. The yellow color formation on the tooth is nothing but the bacteria. Those are the colonies of bacteria on the tooth structure, which is so very harmful to us. And in the beginning, Nihalika was talking about, the teeth problems and the endocarditis and heart problems, etc. So this is the initial phase of the bacteria, which can lead to the other issues also. What in common language we call it as tartar. In the dental terminology, we call it as caliculus. We call it as plaque, but otherwise it is called as tartar. And that's the main immediate symptoms. Anybody having these symptoms of bad breath, swollen gums, or bleeding gums, please visit your dentist nearby. Now, the common causes, and why this accumulation of the yellow color tartar happens in the oral cavity is because of the improper brushing. You see, most of them, they brush on the tooth surface only, on the upper side, but they don't look into the inner aspect of your teeth arrangement or on the tooth surface. They only look on the outside surface, and that's where they use almost 5 to 10 minutes. They keep on brushing, and patients come and tell us, "Ma'am, we're brushing 2 times daily. I generally 10 minutes I brush my teeth, yet I have this problem." See, it's not the amount of time; it is the way you brush your teeth is important. So improper brushing causes gum problems. Tartar, that is accumulation. You can see that yellow patches on the tooth surface, or just below that brushing slide picture. That is, and then comes your improper alignment of teeth. If the teeth are not aligned, she's I think a Tamil heroine or somebody, right? She's saying, improper teeth alignment, or people having gutkas and pan and all that, or some people have the dentures, and you can see the braces people have this because of the proclined teeth and all. They take orthodontic treatment, what we say, clip treatment, commonly used word. Sometimes smoking, which is, of course, there's always a caption, smoking is injurious to health, but people do. And we have seen in the movie Arjun Reddy how very nicely, with what a style the Vijay Devarkonda was going on smoking. So these are the few reasons, the commonly we see for the gum diseases. And how to avoid them, what to best can be done is brushing 2 times a day. That is, morning once, as soon as we get up, we generally brush our teeth. And of course, followed by a tongue cleaner is important. And nighttime also, before going to the bed, please brush, because we all eat food at least 2 or 3 times a day, right? 3 or 4 times also sometimes. And when we're doing that, in case we don't take care of our own teeth, we're chewing with our teeth, but we're not able to maintain it or clean it properly. That's when you have the problems. So flossing your teeth, then avoid smoking. I cannot say stop smoking, but you must avoid smoking. Eat healthy food. Start doing your mouthwash. You have various companies in the market available. You can do one of those, and then try to visit your dentist once in 6 months, your nearby dentist, so that all these small little problems can be stopped in the beginning. Like the way Srijana was asking me in the beginning of my presentation. Yes, visiting a dentist every 6 months, or at least once in 8 months, or once in a year is definitely very important. Now, treatment for gum diseases, what best can be done once you go to a dentist? Because self-cleansing will not help to remove the tartar completely, because it forms a scale on the tooth or on the gum. So definitely from the left side, if you see, you can see how the scales are and how the cleaning is done. And once the teeth are cleaned, how well or how clean they look. And this is the procedure. Now, another common question is relationship between gum disease and pregnancy. This I have added because many of the pregnant women, when they are conceived, they do not know that they have to visit a dentist. Patients come to us in the third month, in the ninth month, and they're just due for the delivery, and they come with a tooth pain. Please remember, even in your families or parents, anybody, your siblings or anyone, friends, do tell them if they have conceived, definitely they must visit a dentist first, because the gum swollen problems, and sometimes you can see the swelling. I have written as pregnancy tumor. So that kind of small little swellings are usually seen on the tooth cavity. Tumor, I don't call it as a malignancy, or it's not a cancer related. Of course, once a pregnancy is over, it goes. It's usually related to the hormones that are there. And that is when, we must definitely visit a dentist. And which is the best time to undergo treatment is another problem. Commonly asked questions. Generally, if the patient is pregnant, if any person is pregnant, woman is pregnant, they must visit a doctor in the second trimester would be safe. But definitely visit your dentist as soon as you are conceived is the mantra that one should remember. Now we are finished with the dental caries, tooth decay. We have also finished about the periodontal or the gum diseases. We're going to another important commonly seen in the present days is the mouth cancer or oral cancer. And believe me, 85% of the high school students these days, they are starting off with the habit of smoking. That is the reason we are finding mouth cancers at a very young age also. We have seen in many advertisements in the theaters, right, where there's one lady, Sunita, she gives a testimonial saying that, she died at the age of 28 because she was taking tobacco. The tobacco in the smoke form or in the gutka form that are available in the market, any of those two forms is actually harmful. And that is the reason she died at 28. There's another advertisement which comes by Mukesh. That boy also, he is a young boy who gave up his life who lost his life because of the cancer. And we say in India, currently 77,000 cases of mouth cancers are there, and out of which 52,000 people have died at various stages of neglect. Now, how can we identify? In case you have any small little lesion or anything, how best you can identify in the house without, suppose you are not able to go to a doctor soon for various reasons, and how can you identify? In case you have a burning mouth for a long time, burning mouth, that means you're not able to eat any of the chilies or masalas and all that. That is when you have to consider visiting a doctor, dentist. Sharp tooth. So especially the elders, please, my dear young audience, in case in your family you see any aged people, your grandparents or parents, where the teeth are totally sharp, please go. You can actually clearly see, ask them to open their mouth and see if they have any sharp teeth. Those are the teeth which actually are harmful. They are the teeth which are a culprit for the cancers in the mouth. Please remember. And next is any swellings in the mouth, or if anybody is not able to open their mouth properly or brush their teeth properly, and if the food eating is difficult, or if there is a weight loss in the body, any of these symptoms, please visit a dentist. And self-examination in the mirror is a must, especially for those who are with the tobacco habits. So in your family, if anybody with the habits, make sure that they have to self-examine themselves. And any of these symptoms of burning mouth, sharp tooth, swellings, inability to open the mouth, eating food, etc., weight loss, to be taken care of. These are all the warning signals actually. Yeah, there's a picture here I put on gutka chewing, irritation. See, you can see in the second picture, irritation in the slide. That's because of the sharp teeth. So repeatedly, the tongue or the mucus or the cheek, gets abraded or irritated on that area. You can see a reddish mark there. Please definitely go to a doctor. Though we can see Rajnikant, Mr. Rajnikant smoking away to glory in his, and he being a celebrity icon. I think people are following his style, but for him it's okay because he does it only for the movie. But people are following him, and that's becoming a habit for many of them. That's what we have to be careful with. Alcohol in combination with smoking is harmful again. Spices, various different spices, especially the red chilies with our Gunturu red erakaram antuntaru. That is very very spicy chili it is. That is also to be avoided. And genetically, suppose, yeah, in a family it runs sometimes, genetically any demarcation, any changes in the body, also can cause, the cancers. Any virus and chronic diseases like diabetes, heart attack, any of such chronic diseases also can lead to the oral cancers. Of course, not a direct relation, but will have with other factors, it can lead to cause oral cancers. How can we prevent? Of course, whatever the reasons are for the oral cancer, those to be avoided, like alcohol to avoid, eat more fruits and all which have a lot of vitamin D and vitamin D, vitamin E, B complex, vitamin C, and broccoli, this cabbage, cauliflower, the foods which have calcium, those to be taken in, because all of them have antioxidants in them, and to some extent they can prevent cancers, especially the turmeric. I'm sure everybody uses turmeric at home in every dish. If the boys are there, you can ask your mothers. Definitely, they must be using haldi. And I would advise, give a small tip here, a chitka here. You can take a little bit of haldi, half a spoon of a haldi, half a spoon, a pinch of haldi, put it in little warm water or probably milk. I would say warm water is also sufficient. Mix it nicely and have it every day. That's one very good remedy to avoid any kind of ulcers or cancerous lesions or preliminary lesions, small lesions in the oral cavity. See a dentist regularly and proper brushing. All this can actually help you to prevent from having any kind of malignancies or cancers in the mouth. The various treatments, as you know, surgery, radiotherapy, chemotherapy at different stages. When a person has oral cancer or mouth cancers, they can undergo. That is, of course, not our purview. Any questions, Nihalika?
Yes, ma'am, there is one.
Yeah.
I'll read it out, ma'am.
Yeah.
Rajesh, ma'am, as you said, dentist suggests the toothpaste. So, my question is that do we need to change the toothpaste depending upon the temperature, especially in the cool regions like North India?
Yeah, Rajesh. Yeah. Toothpaste need not be changed, but based on the region where they live, but toothpaste has to be changed, or a person has to shift into a new toothpaste when there is a change in the internal temperatures of your teeth or in the mouth. Like, suppose you have sensitivity to hot or cold, that is when the toothpaste has to be changed. You have to get into a medicated toothpaste, which we call it as desensitizing toothpaste. Otherwise, if you're living in Delhi or you're living in hot temperatures of Tamil Nadu or the Andhra states and all that, that doesn't really matter. In case you have any problem, only then a doctor advises. And I would say use a normal toothpaste that is available. Any problem, just visit the dentist and they would probably suggest that.
There's one more question, ma'am.
Yeah.
Hemant, hello, ma'am. Can you tell me about fluorosis and its treatment? Is Anafix is good to use for fluorosis on a long run basis?
Sorry. Nihalika?
Yes, ma'am.
Yeah, there's some
Sorry.
problem with my net. Yeah. One second. Yeah. One second. Yeah, you please repeat the question.
Yes, ma'am. Hello, ma'am. Can you tell me about the fluorosis and its treatment? Is Anafix is good to use for fluorosis on a long run basis?
Is Enafix? What is that?
Maybe a medication, ma'am. Even I don't have idea about it.
Anyway, who's this person who had asked me? Who had asked this? Name?
Hemant, ma'am.
Yeah, Mr. Hemant. I hope Hemant is listening to me. Mr. Hemant, fluorosis is a condition. It's a condition which transforms your tooth structure, which changes the tooth structure internally because of the intake of fluoridated water, mostly fluoridated water only. Okay, so when the structure itself changes, it's so very difficult to change the tooth color from external application. It's something like, can we change our skin tone or skin color? We have various, lotions and ointments and creams available in the market, like Fair and Lovely, Fair and Glow, and all that. But can it change actually the skin color? It cannot. The skin color changes only when we apply a makeup over it. Now, when we're going for a wedding, the bride has been applied by a makeup, right? That is when the color changes. If she's a dark skinned or a medium skinned and all that. So similarly, a tooth color which is internally present the color cannot be changed by any medicine. It's that with external treatment methods, cosmetic treatment methods, we can actually change. There is one procedure called as bleaching that we do, but bleaching is again an issue. There's again a lot of controversies. For a temporary presentation, probably bleaching can be done. But in long run, bleaching also can be harmful because it causes sensitivity of the tooth. So I wouldn't advise that. If fluorosis is a concern, definitely go for a cosmetic treatment instead of bleaching. That is as per me, what I would do to my patients. Next slide. Next one. Any other question?
Yes. No, name is not given, ma'am. So
yeah. Remedy for gum pain. Now, gum pain can be, again, as I told you, for various reasons. Gum pain can be because of gum infection only, or tooth infection, and there can be a gum pain, or there is a tooth which is coming out. Also, there can be a gum pain. There can be a laceration because of hard brushing. That also, there can be gum pain. So, gum pain can be due to various reasons. So depending on the type of gum pain, actually the medication or a toothpaste or a gum massage is generally advised. Now, generally any painkiller can be given, like, any painkiller like from a simple paracetamol. Probably you can use any kind of a painkiller for your gum pain. And of course, if the gum pain is because of infection that is there, yes, we must start with an antibiotic and then a painkiller. So I would think I would advise them to visit a dentist than self-medication. Next slide. Next. Anything else?
Done with the questions, ma'am.
Yeah.
We can continue.
We can go ahead. Is it getting delayed? Am I slow, fast, or is that fine? Can you tell me, suggest me, Nihalika?
Yes, ma'am. We are a bit late now. So
we're a bit late. Yeah, that's why. That's why. Not bit, I think quite delayed, right?
Yes, ma'am.
Yeah. So do you want me to go a little speed up?
Yes, ma'am.
Yeah. Now comes with the wisdom tooth, that is 18 years, above 18 years, generally the wisdom teeth erupt. And when they're erupting, it's 18 years. We also call it as the akal ke dant, right? Akal ke dant, or post-maturity, mature, that's the age we say teeth erupt. And that's the third molar. And once all the third molars, 3 molars are there, that's when we say actually they have 32 teeth in their oral cavity. And anybody noticing a pain, radiating pain, or swelling, immediately please visit your dentist, because definitely it is a pain. They say some pains are physical and some pains are mental, but the one which is both is the dental pain. So, and that is mostly seen among the wisdom teeth. So please visit your dentist in case you have any issue with that. And generally, if there is a pain, the tooth has been removed, a painkiller is be used, and medication can be given. Just the way that's how the tooth is removed. Then comes your joint pains also. Again, another commonly seen issues these days because of infection or bruxism. Bruxism is something they keep certain people, they keep clenching their teeth all the time, biting the teeth. If they're in angry, or if they're doing any work seriously, that's when they start clenching the teeth, So when you notice, you can see from the sides, you can see this kind of a movement, and that's what we call as a bruxism. That's a very wrong habit for anybody because it leads to the joint attrition also. And probably many people would not have teeth for a very long time. That causes imbalance in your teeth chewing habits, and that again causes the joint pain. That's all these things happen in the long run. And then there's one more congenital anomalies. People like cleft lip and cleft palate, when they're not treated at a right age, at a young age, again, jaw problems can be there, and definitely there can be issues. Loss of back teeth. Maybe some people, when you see, they tend to eat with the front teeth. They bite as well as eat from the front teeth. And as I told you, the eating has to be done on the last teeth, not in the front teeth. So when we do with these teeth, that is when, again, there is improper chewing, and it can cause joint pain. So any of these, the way any of these conditions which are there, open, teeth are open and all that, they're not properly aligned, the face is like that, any of these symptoms are there, please has to be visited, the dentist has to be visited. And for that, definitely various treatments are available, like helmets, mouth guards, etc. And any of these can be followed, medication can be given. Sometimes there can be injuries for the children, when they're playing, sports injuries or falls or while running, and so many injuries at home. So this is commonly that I see. Injuries are there, and the front teeth actually, they fall off. Patients come to us saying that, padipoyandi, road మీద వెళ్తున్నాము, sudden గా accident అయింది, tooth పడిపోయింది. They get the tooth actually. But always remember, tell your people, family, everyone, that once certain, anything like that happens, the tooth actually has to be either placed in salt water, we call it as saline or milk, or any plain water at least. And immediately, if the tooth is brought to a dentist, it can be saved. We do some kind of a treatment called root canal treatment, where you can see the white thing on the picture there, on the extreme right, small radiograph. So that's how it is been filled, and we can place back the same tooth in the socket from where it has come out. So this is one very interesting point which we wouldn't know. Then, of course, the cosmetic treatment. If the teeth are fractured, teeth are yellowish or black color, or the proclined or improperly placed, small teeth, all these things can be treated well. And that is a special department, cosmetic dentistry, that we say. And of course, it's very highly payable and lucrative for a dentist, this particular treatment modality. Now we have this indigenous practices. Somebody asked me about the salt, right? Oil pulling. These are all what earlier days of practice. But these days, these are avoided because the teeth structure, as the evolution process, the teeth structure is not really healthy like what it used to be before. The calcium content of our foods is not healthy. The mother, the pregnant woman, is not taking proper diet, and so the calcium of the teeth of the newborn kids, babies, is also not healthy. And that's the reason, their teeth as such lost the the strength. So using any of these indigenous practices is not very much advisable in the present days. Kitchen remedies, of course, suddenly we have some pain, we still find people using clove, garlic, salt water rinse, cumin seeds, what we call as jeelakarra, or vamu. Vamu also people use, vamu or cardamom seeds, etc. So these can be used. And wheat grass. Vamu ante meeku in Hindi we call it as ajwain, that also can be used. Wheat grass is like in the juice form, and we take that actually can actually control some amount of inflammation in the gums and all. Similarly, mint or pudina antam kada, that also can be used. Clove, of course, most of our dental products, certain oils, we use, and in that clove oil also is there. These are certain immediate kitchen remedies. Of course, it is not that I would say this has to be followed, but these used to be followed earlier in case of emergencies before they visit the dentist. Now, dental diseases and the systemic other body system. Any elders above 45, 50-year-old having diabetes or BP or any heart respiratory problems or lung diseases, etc., any kind of pregnancy and all these people, because of sometimes their less or reduction in the immunity or the drugs that they use, they can have the problems like gum diseases, dry mouth, lichenoid reactions in the mouth, that is patches on the skin as well as in the mouth, loss of taste, bleeding from the gums, fungal infections, we call it as candidiasis, burning tongue or the mouth, and they cannot actually eat or even put a little amount of chili or spice in their mouth. That severe the burning mouth is. Mouth ulcers are there, discoloration of the tongue and the teeth, angular cheilitis, and the metallic taste. Angular cheilitis means, we can see the angle of the mouth. Many of the elders who do not have teeth properly and who do not chew their food properly, who just swallow the food, such people generally have a cut in the angle of their mouth or lips. Please notice that. And in case that issue is there, visit the dentist and proper medication has to be given. So these things are generally noticed in any of the systemic diseases or like heart disease or diabetes, etc. Simultaneously, the heart disease and all, those people also have this. And when the people come to us, with swollen gums and all, everything hygiene is fine. They brush their teeth regularly, and then yet we tend to notice, are you a diabetic or are you a hypertensive patient? Then they say, yeah, I'm hypertensive and I'm using the tablets for a very long time. So the drugs that they are using, those can also cause the gum problems. So it is vice versa. But whatever, mouth is the gateway for the complete body. So we have to take care of the body, and the body also has to take care of the mouth, because they go hand in hand. It's part of the body system. Now the common questions, how many minutes do I brush? Brush at least 2 or 3 minutes per day. When I was brushing, sometimes I see bleeding from the gums. What could it be? Yeah, bleeding gums could be because of the food that is remained on the tooth for a very long time, food that is remained on your gums for a very long time, and probably you haven't removed that, and that is the reason you have little gum infection, and that's how you'll have bleeding from the gums. While taking hot and cold beverages, I feel jum. Yes. Now it's because there is some amount of enamel wear, or the tooth structure on the tooth surface is gone because of a hard brushing or for whatever reason, or there can be a fracture of a tooth and so on. That can cause jum feeling or sensation. So again, avoid hot and cold and then visit a dentist. Which toothpaste to be used? Yes, somebody was asking me about toothpaste. Yes, any toothpaste available in the market can be used. Any toothpaste available. But how much toothpaste to be used is what is important. So please remember, the toothpaste can be just like a peanut size, very little peanut size of a toothpaste can be taken on the brush. Put it on the center of the toothbrush, like what we see in the picture there. Across on the right side, how much of paste to be used have written. So that is the paste, and that paste has to be rubbed on the bristles or across on the toothbrush, and then start brushing, because evenly it spreads into your oral cavity. Suppose we do not spread the toothpaste, what happens is some amount of toothpaste actually falls off into your wash basin. So a toothpaste of 250 grams or 150 grams has to come for 4 people in a family for a month. That comes only for 10 days. So why waste money? So the commercial ads, when we see, they show you the Colgate people and Pepsodent and all this. When you see the advertisement, they show right from the top, on the toothbrush, they show that much, the full toothbrush, the paste is being spread. Please do not do that. Take a little amount, spread it on your toothbrush, and then brush your teeth. Do not waste your toothpaste. If I lose wisdom tooth, do I lose my knowledge? Definitely not. There is nothing to do with your wisdom. It's just that your pain can be relieved and you can live more happily. Should I use a tongue cleaner? Yes, definitely. You have to use a tongue cleaner. As I told you, toothbrush and the tongue cleaner, they go hand in hand. When should I change my brush? Yes, in the picture, as we see, the brush, when the bristles are flared up, repeatedly hard toothbrush. People go on using their brush while they're watching television or a hot something happening in the television and some politics or something like that. They brush so hard, and that's when the toothbrush flares, and that's when you need to throw a toothbrush and use a new toothbrush. Which brush to be used? Yes, again, any toothbrush available in the market can be used. It's only the marketing strategies that we have various types of toothbrushes available, but I would say a soft toothbrush with a small head can be used. So when you're buying a toothbrush, just select a toothbrush which has a short head and soft bristles. Don't go by the price or the company or the brand of a toothbrush. Any questions, Nihalika?
Yes, ma'am. I'll read it out now. Shravanti. Good evening, ma'am. I have bleeding gums but no pain or swelling. Can you please suggest me any solution to get off it?
Yes. Bleeding gums, just definitely not to worry. You can start using brushing twice daily, morning and night. And when you're brushing, be little conscious and as well as cautious. Check into your mirror while brushing and make sure it is passing on all your teeth and all the food that is being accumulated, especially in the last teeth, the molars that we say. Those are the teeth which are important because that's where you're eating. So on the outside as well as on the inner side, both sides you need to make sure the food is being removed thoroughly. And that's how you can actually you can avoid or have less amount of bleeding, or probably you can control bleeding. But if it persists, yes, must visit a dentist then.
Yes, ma'am. And another question from Tanmay. Good evening, ma'am. This is Tanmay. I have spaces between my teeth and I opt not to have braces. What extra care must I take?
Right. So, yeah, definitely. The answer is you have to take care because you already have spaces. Now, spaces, where do you have? You have in the front teeth or you have spaces in the behind teeth? She was not specific, right?
Yes, ma'am.
Yeah, that's fine.
Front teeth, it seems, ma'am.
Yeah, if it is the front teeth, Tanmay, if your age is good enough, you're young enough, if you're below 25, 30, I would definitely advise you to go for a cosmetic procedure where you can actually close your teeth and have a good alignment. That gives you a good smile also. Okay. Yet you're not interested, then I think you still have a cosmetic treatment where we actually try to lengthen or the width of the tooth structure to shorten the gaps between or to lessen the gaps between the teeth. That also can be done. Yet again, even this also you don't want to go, then I think you need to brush twice daily so that you can avoid any food impaction. Yeah, that's all.
Another question, ma'am. Johnny, ma'am, one of my incisor is broken and my another incisor is too big. Now, how can we get the incisor which had breakdown?
Yes, okay. That particular incisor which is broken down, when did it actually happen? When did it fracture is first thing you should know. If it's a long time, yes, definitely go for an X-ray. You have to go to a doctor, get an X-ray made and see how much of a fracture is there. And based on that, definitely a very good treatment can be done. And it would definitely be like the way you had it before, the way you have your other tooth. That beautifully it can be made. No doubt. Johnny, please go and visit a dentist now. Don't delay, because sometimes it can lead to other infections and then you may have pain also in future. Yeah.
Yes, ma'am. Another question. Shweta, how much time should we brush? Oh, it's already done, ma'am.
Yeah.
We are done with questions, ma'am.
Yeah. Johnny, we can also go for we generally give a cap or a crown, what we call, on the fractured tooth. And before the cap or a crown is given, we try to check with an X-ray to see for the health of the tooth, how healthy the tooth is. And based on that, the type of cap or a crown can be given. If any further treatment has to be done, we do that and then place a cap or a crown. Okay, we're almost coming to an end now. The common myths and facts in dentistry, what we see. So if there is no visible problem, the common myth among people, if there's no visible problem in my teeth, I don't have to see a dentist. The fact is, you should visit a dentist twice a year to make sure that your teeth stay healthy and any dental problems are treated. It's not that because the first question Shrujana has asked, if I go to a doctor, is it fine? Yes, I would say that yes, before any problem arises, just go as a preventive measure to a dentist. Regular dental scaling causes weakening and mobility of teeth. Scaling means again cleaning of the teeth. As I told you, the bacteria that is there in the oral cavity in the mouth, the plaque that is there in the mouth, that has to be removed, and we call it as scaling in our dental technology. And dental scaling removes the deposits like plaque and bacteria or calicula's, what we call in our language, and tooth surface, thus preventing tooth decay. So definitely cleaning has to be done. Please check your mouth in the mirror today, and in case you have any deposits or any plaque or yellow coloration, go to a dentist immediately. All dental procedures must be avoided during pregnancy. Definitely not. Procedures can be done, but procedures like x-rays and any major surgeries, we generally avoid in pregnant women, because pregnant women, by nature, because of pregnancy, they have this issues of hypertension, that is BP, or diabetes generally. So to avoid any complications, we say don't go for any dental procedures, because the dental procedure can build up some apprehension among them. So we tend to avoid. Excuse me. But in case if there is any problem, still you have a problem, I would say second trimester is the best time to go visit. But above all, even if your gynecologist, if the gynecologist has not suggested, remember, any pregnant women, when the news of conceiving has come, definitely it's a good news. And once the news has come, they must visit a dentist to avoid any problems in the late pregnancies. Brushing my teeth more than once a day can harm my enamel. Definitely no. Most dentists recommend using a soft toothbrush, as I told you. Avoid being overly rough on the gums and teeth. If you do so, definitely, nothing happens to your enamel. My eyesight or brain will be affected if my damaged tooth is extracted. Yeah, this is a very, very common myth among many people, educated, uneducated, urban, rural areas, anywhere you go. This is one common problem. Extraction of teeth, removal of a tooth can cause eye problem. It's not so. I got 4 wisdom teeth are removed, but I'm fine today. I have my specs because I'm 50-year-old lady now. So otherwise, a tooth removal doesn't have any effect on your brain or any of the eyesight and all. It's just one of the treatment we have. So please do not worry on that aspect. Applying warmth over the extracted area can reduce pain and preventing swelling. Applying warmth over the extracted area that's definitely not. So warmth, nothing will happen. And the doctor will suggest when to apply, when not to apply, even before removal of the tooth and after removal of tooth. So please do not worry on that and go to dentist again for a proper suggestion. Brush properly, I'm free from dental disease. This is one major misconception people have. They say I brush 2 times daily because they see in the advertisements, brush twice daily, this much of toothpaste they take, brush nicely. So I don't have any problem. It's not so. How you brush, what kind of method you're using, how much time you're using, what kind of a toothbrush, all these are important. But before all, visit a dentist first and then learn more about your teeth first and then start practicing with the good intention. Cavities are only caused by sweets. Yes, generally, I told you, sweets are the important thing, but not always. Sweets are not the only thing. Sweets which are sticky in consistency or carbohydrates which are having starch, those are the sugars or sweets that can harm our teeth. And also the tooth structure, which tooth structure, how it is, those are also various factors.